I'd like to welcome you here to our report out for our two-day workshop that we've held here today. Just to say that where this two-day workshop has originated from is part of the process we've been going through about starting to work more closely together. And originally this came from a conversation that myself and Doreen had back in sort of late summer. And at that time we were looking at a lot of difficulties around our services, around sort of the increased demographics that we have across our patch, across Cumbria, about the increased pressure around our services, the financial situation that we all have impacting on our services, and we were really wondering about what we could do about it. And what we were sort of talking about was that despite all those problems, as a professional group that touches into all our organisations, we do have the ability to do something about it and to change things. John Howarth, one of our directors within Cumbria Partnership, came and spoke to us earlier on, and he sort of used an analogy of a sinking boat, in that what we have, what can feel like, is that we have a boat that's rapidly filling up with water, and we are all having to rapidly bail out the water. And as it increases the water, we get more and more people into to bail out faster and faster. But what we actually need to do is to stop and fundamentally redesign the boat. So this is occupational therapy within Cumbria's attempt really to start to redesign our boat to support all our services across our patch.
We then reconvened in October with the 4 areas that predominantly provide OT services within Cumbria. There was a great will at that meeting to take this forward, bound by the values of providing a good service to people. And we focused on 5 areas, which were the handoffs and what we saw as duplication, multi-professional and leadership issues, training across the board, moving and handling, and communication. We decided that we would look at some improvement areas, get some data collection, and look at some patient or customer mapping. We reconvened in December to look at what we've got and what else we needed to obtain. And the results were really quite jaw-dropping. What we thought was happening and what was actually happening were 2 very different things. And you can see by the mapping around the wall of one patient or customer journey, how much involvement's in that and how many transfers there were or weren't. And so we looked at what data collection we had, and we realised that we needed more, and so we brought that to today.
So following on from John and Doreen's introduction and placing where we are now, we looked at tools that we could implement throughout the OT mapping event and moving forward into the rapid processing involvement workshop within our service as a whole. This included PDAS tool, improvement and elimination of waste, and the 5S workplace organisation tool.
And we spent time together looking at the patient maps that were collected from a wide variety of services across adult social care and health. And when we were looking at those, it was really apparent that despite there was a will from all the OTs involved to give people a good outcome from services, the same problems were arising for all of us across the county and across the services.
And we also looked at data that highlighted where OTs were placed across the county and the demands that what we have on our service. However, this also highlighted the need for further accurate data to be pulled together to form a baseline to work from.
And finally, on day 1, we had an overview from Strata Information Services that outlined the possibilities and the opportunities that their system has to help us enable working together in the future.
After we've been given the tools to work with in day one, day two has been spent with the amazing privilege of being able to sit in the same room with lots of different people across lots of different organisations and actually discuss our processes, our procedures and where things work and where things don't work. It was an amazing opportunity to have that shared integrated vision and to look at the patient's view and then to move that into the staff view of how we map our services together.
Thank you. As Vicky said, day two gave us the opportunity to look at the whole OT process that we commonly adopt across Cumbria. Now I thought that would be really tricky. I thought with adult social care and with acute and community services we would have a difficulty finding that common strand. But actually what we found was it enabled us to get to the nitty-gritty of the OT process and what we all do commonly. It also highlighted, I suppose, elements where there is potential for duplication and overlap, and also where we maybe don't effectively hand over care between different elements of our OT organisation. I think the other thing that it did was it emphasised the will that we all have to work together and the commitment that we have and the good practice that goes on within OT in Cumbria. It also enabled us to identify areas for improvement, and those key areas such as training across boundary within Cumbria, transfer of care between occupational therapists and the criteria for liaison between OT services are areas which we want to take forward and work on in the future.
Okay, so as Alison said, we felt there was a lack of clarity about roles and service provision. So one of the planned improvements was to create an agreement regarding roles, boundaries, accountabilities across the service which will be county-wide. So the planning to achieve this, that we need to have an understanding and agreement of service provision, and there needs to be clear lines of accountability, and we need to reduce the gaps for an improved customer service. We also need the practical application of the document within the different areas. So how we plan to approach this is that we're going to be inclusive of health and social care, and we are going to look at the existing policy, which is a draft protocol, which is adopted in some areas and not others. We're going to review this and then we're going to agree. The possible barriers are that there may be a lack of engagement, there may be a lack of will to make it happen, and there will probably be work pressures to engage. How we're going to review this is regular peer review, so we're going to have agreed timescales for the sign-off and roll-out, and we're going to review them, and we're going to cascade and adopt it within the services. So what we need to do is obtain the document, we need to look at eligibility criteria for different services, and we need to involve the key stakeholders, which includes Carlisle Infirmary, Adult Social Care, Morecambe Bay University Hospital, Cumbria Partnership Foundation Trust and the acute.
Our second area for improvement that we looked at was about the number of handoffs that happen for people through the journey through occupational therapy. We felt we needed to understand this to improve it and move it forward. A poor transfer obviously has a huge impact on people, and there were gaps in the transfer too, so if we can improve that, it's got to be better. What we want to develop is a good protocol with a speedy service, better customer outcomes and an improved process for everybody with less frustrations. The process we thought we needed to do to achieve this was to collect the data on what exists already, to look at people's forms, service directories, guides, things like that people keep, and reflect and share on this as a group. The barriers we thought to doing that really were the same as with the previous bit of the work we need to do, is getting everybody involved. The pressures of work, daily work, all impact on us, changing priorities, things like the Care Act coming into place are impacting on people. So that all will affect us. Once we've done it, what we hope to do is provide something that's there for everybody, for their learning. We'll review it annually and keep it as an up-to-date document and feedback on it. What we'd like everybody to do is become involved in this, managers, senior managers and the sponsors, putting out a message that this is going to be a mandatory document and it's good practice that we'd like everybody to adopt.
Our final improvement project is around an identification for a requirement for occupational therapy training across organisations. The planned improvement was we identified that there was a lack of shared training, language, understanding of cultures and drivers to change. We wanted to improve customer journey and effect a seamless transfer of care for our service users. And we needed to have an understanding of our roles and responsibilities and prevent duplication of training that's already in place. Benefits were an improved patient or customer journey, improved safety, reduction in risk both to our service users, professionals and our organisations. That there would be a better partnership working, better customer outcomes and improved staff satisfaction. We would approach this, there would involve a massive scope in what requirements are there to identify the skills in existence and the gaps that need to be filled. And it would hope to produce a cross-agency training plan. Barriers to successes in this are about work pressures for engagement, as mentioned previously, the scale of the task across 4 organisations, resource requirement across the services, and the potential resistance to change. This is a new way of working. We would require support of our sponsors because obviously working cross-agency, cross-organisations, we need their support. And we also need our partner commitment to make this a success. And as mentioned previously, it's adult social care, Occupational hospitals, Cumbria Partnership and Cumberland Infirmary. From a review perspective, we'd see its success by looking at how the plan was implemented and how successful it was in people's engagement in it. So these are big projects, but we've actually got some quick wins that we are even on with as we speak at the moment. So some of the quick wins were about how do we access advice before we make a referral. And we've identified today that we're going to have a shared point of contact for each service or organisation so that it's almost like a single point of access for somebody to make initial inquiries. There's a legal requirement for manual handling reviews, and it would appear that there's a massive hidden workload out there for our adult social care colleagues, and they're in the process or about to take a deep dive into the demand that's out there. With regards to communication systems and protocols, as mentioned previously briefly, we've looked at cascading strata, raising awareness with staff to know that it's out there, that it's currently in use, and see what its potential is as an IT solution to a lot of the issues that we struggle with.
So in summary, we've had a fantastic opportunity over the last 2 days to look at actually what is happening on the ground and be able to look at the areas that are going to make a significant difference, hopefully with some quick wins and some more in-depth work. We've had the advantage of having those 2 days. We've had lots of enthusiasm and willingness to engage, to make a real difference. Because as I said earlier, that's what glues us all together. We want to do a good job. But in order to do that, because there is the will, things happen on the ground despite the systems that we have, because of the good working and individuals going that extra mile. We absolutely need people on board from the top, not just the sponsors, but our managers across all our agencies in order to make this work. It's absolutely crucial. And it's also crucial that we get the message out to all our colleagues to get them on board, because this is how we have a voice across Cumbria, and a strong voice. I'd like to say that our North Cumbria colleagues aren't here today because of the pressures of work, and hopefully they will be here for the rapid process improvement workshop, because it's vital really that we have everybody on board. We have strength in numbers and we really need their management on board as well. So hopefully the will was there, but the pressures of work have obviously affected today. So hopefully they will be here for our rapid improvement workshop.
And also like to say a big thank you to all our colleagues across our organisations and the managers for enabling us to sort of take this step and begin this process, because obviously there's us in the room over these last 2 days, but there's an awful lot more people out there who are supporting us in order to do that. And I suppose for myself, so I'd like to sort of bring it back to the beginning where we're saying about the increased demographics and increased pressures. And we can't do anything about the increased demographics or the increased pressures or the financial situation. But what we can do is work more closely together and to make our services work in a lot smoother and more aligned way. And I suppose I'd like to just to sort of for myself to say that I've actually always been really proud to be an OT. It's something that's absolutely to my core, and I feel a great passion for what we can bring to services and people within Cumbria. I also feel extremely proud to be working and living in Cumbria. I think it's such a fantastic county with fantastic communities, and so for me this has been an absolute joy to be working really closely with our colleagues in our organisations to make occupational therapy make that extra difference within Cumbria.
And just to finally once again say thank you to our sponsors for coming today and for allowing us the time to be able to invest into this. And I would like to just say that our next stage is on the week beginning the 9th of March, that we will engage in the rapid process improvement workshops, and it will be extended out to other key stakeholders to engage and move this forward. Thank you very much.
Thank you.
Finally, I'd really like to say thanks, a really big thank you to CLIC for all the support that they've done for us over, well, not just for 2 days, but this whole process. I really don't think we would have got to where we are today, and certainly wouldn't have achieved what we've achieved over the last 2 days without CLIC support. So a wholehearted thank you from all of us.